Welcome to Prescription for Primary Care. I'm your host, Tanya Dodaro. We have a powerful lineup of guests. Dr. Jordan Vollrath, family physician and chief medical officer of Cherry Health, and Dr. Raymond Rupert, who built RCM Health's leading complex care platform. Welcome to both of you today.
Thank you,
Thank
Tanya.
you.
In an era where technology has revolutionized everything, every part of our lives, everything from smart devices at home to vehicles that can drive themselves, the healthcare sector, especially primary care, seems to be lagging a bit in tech adoption. What are the factors that you believe are contributing to this delay in modernization?
Oh, there's a lot. Healthcare is slow, right? It's conservative. You just don't have a lot of early adopters when it comes to tech. There's still so many clinics across the country with paper-based charts. There's still so many hospitals. So it's definitely not even just limited to primary care, but I think this is part of just why Canadian healthcare is in such a hole that it's in right now. Is just this kind of like lagging to adopt is endemic across the entire industry.
How hard is it? How hard is it to adopt to, instead of like a written prescription, to a non-written, a prescription written through a computer sent directly to the pharmacy? Raymond, I'd love to get your perspective.
I used electronic prescriptions at one stage, but the world of the regulators thought it was inappropriate, and so there's a whole sort of force that prevents innovation in a lot of cases. But there are things that are really picking up, like the AI scribes. Jordan, do you know about those?
Quite a bit, actually. I use those almost every day. That's definitely been one of my favorite new tools.
So you're an early adopter.
I would say so. I'm also a laggard. I've got like another contract in my inbox from the good people at MyViva, like a patient engagement tool that I've been dragging my butt on signing up for and getting onboarded for several months now, just due to like time constraint of like having the time to learn how to use this new thing. And it just seems like, another thing on the giant never ending to-do list pile.
Yeah, well, the AI scribe, for example, saves you a ton of time, effort, energy, etc. So,
100%.
That was worthwhile. What do you think your next adoption is going to be in terms of innovation?
Probably this patient engagement tool. Like I spend so much of my day just like trying to follow up with patients. Like, are you sticking to your goals? Are you following through on, whatever this nutrition or exercise or whatever the things that we agree with during our sessions. And then you're kind of limited in how much interaction you can have with patients. Like you can't be checking in every week to see these things.
This is a compliance tool. This is post-visit.
Compliance sounds harsh. That sounds like punitive. This is more of a engagement, like keeping them reminded, keeping them, daily check-ins, just like we get notifications from your Facebook, your Instagram, your LinkedIn, your Gmail. Everything's constantly beeping at you. So now having like a healthy thing actually beeping at you and notifying you of these things that are important.
The surveillance state comes to post-visit.
I'm sure these are all connected somehow. Yeah, exactly. Jeff Bezos will find out.
Well, you can also there are other tools that you can use before the patient comes to see you. Like to take the
How do you typically do it?
Yeah, well, to take the history. Those are clever tools.
Yep.
Got the history, then you talk to somebody, it's transcribed, it all goes into the EMR, and then you can follow up with the surveillance tool. Wow.
Keep it all going. Yeah, exactly. The full life cycle.
Excellent. Okay. And what about team-based care? You got a team in your clinic or?
Actually, so at the weight loss clinic, the Alberta Obesity Center I work at, is very, very multidisciplinary. We work one-on-one with nurses. The nurses follow up with the patients independently. We've got the dietitian in there, numerous different physician teams. So there's actually quite a bit of like team model going on.
And that's provincially funded?
Yep, correct. Yep.
Okay, well, that's great. I guess there are some private obesity clinics as well.
Certainly. Well, the obesity center, I guess, team-based care as it's kind of coming into vogue right now in the premise of like, how do we bill, how do we manage all these things? It's not primary care, I guess, right? It's not like undifferentiated patients coming in for, general family doc type symptoms. It's very focused, so kind of misses in terms of that.
Well, I just spoke to a doc who's got 2 NPs, nurse practitioners, in his practice.
Yeah.
Like, he's coasting. Like, he can just get out in his Chris Craft and enjoy the day. Like, he's got a team at work in a general practice, and it's working really well.
At some point, if you want your like career to evolve, right? How do you uncouple yourself from the one-to-one input of your time to patient outcomes?
One-to-one is very sort of pre-inductive. Like, the doc should be conducting the orchestra, should be leading. So having an NP, an RN, a physician assistant, a qualified IMG or something as the team, which then allows the doc to probably, if they're fee for service, they could double their roster.
Oh, definitely. That's the other thing that's going to be really interesting is the PAs coming forward now. That's definitely gaining some steam. Again, it's just a matter of how does the billing model catch up with that is going to be the rate limiter to adoption.
It'd be great if the ministry would just write the check, the 80 or 100 grand for the PA. Is that going to happen?
While, yeah.
Yeah, subject to prayer and uncertainty.
Very much so.
But there are likely going to have to be some creative models to essentially fund the team, because not every practice will have ministry support for that.
No, exactly. It's going to take some time, but hopefully as the case examples start coming out and the data and the case for it becomes stronger, they'll start having that be publicly funded. Yeah,
that would be great if everybody could have access to a team. That would be.
Will having a team in clinic require even more technology and resources to make sure that everything's functioning the way it should be?
I mean, there should be adequate software to do task management, for example. Like, when you've got a team, you're assigning tasks to various team members. So that functionality has to be in place. And ticketing systems, for example, do that. So, the tech's around. It's a matter of moving, as Jordan says, from the one-on-one model, where you kind of marry the patient one at a time, off to really working with a team.
I think we're going to need some back-end upgrades too, right? It's like you look at any modern company, right? They're using Microsoft Teams for their, internal communications, or they're using Slack, right? Where you've got different channels and it's organized and it's not just one-to-one direct messages. I think that's another area that healthcare is really lacking in right now is, I can message one of the nurses on the EMR. I can create a task to, follow up for closed loop communication. But when it comes to that, just collective sharing of ideas and working together digitally, it's still very challenging outside of the break room where you're just having these conversations.
Yeah. So I was lucky enough to get an MBA. And one of the key things that you did in an MBA was work on teams. So collaboration, the big C, collaboration was really essential, and you learn that skill. Well, when I went to medical school, it didn't have the same resonance. You were sort of an independent guy, and the resident sort of put you down, and the staff person ignored you. Like, it wasn't the same thing as working on a team where everyone was respected. So
you worked on a totem pole with a defined structure.
That's right, and the big guy was at the top, and you go in the OR and worship what they're doing.
Hopefully, I think healthcare culture is catching up. It definitely is a little bit that antiquated model. I don't know. Dude, my medical school experience back in the day here, 2013, 2017, they were actually pretty collaborative, and it really kind of was striking that right out of the gate, right from your undergrad degree, where everybody's scrapping it out to try get the 4.0, and it's dog eat dog, and then your medical school, suddenly everyone's sharing notes and helping each other out, and I don't know, right from day one it was a very different vibe.
Yeah, well, I'm sort of an older dude, and it was not that collaborative when I was going through there.
Okay, so we are progressing.
Many moons ago, but also in terms of patient expectations. Patients don't necessarily sit silently in the corner, like they get engaged, especially, the new generation of patients who really want to partner with the doctor because they can all read the research. They want to have a more, sort of intelligent, shared conversation in a respectful manner. So, yeah, I think that's changing as well.
Definitely.
I read recently, it's been noted in a few articles that Canada's healthcare system is undergoing what they're calling a digital transformation. I'm curious if you agree or disagree.
Yeah, it's happening a little slower than everybody would hope, but I mean, we're seeing it. Like, again, back when I was doing my medical school, there were computers in the hospital running off a command line prompt, like operating systems like MS. I don't know if it was actually MS-DOS, but it looked exactly like MS-DOS. And so now we have mouses with cursors in the hospital. So we've come a long way, even with a short period of time. Hopefully it continues that same trajectory.
Yeah, but I mean, it's changing with AI. Yesterday, I spoke to a family where the young lady had hemochromatosis. And it was diagnosed by an NP because she was having panic attacks. So then the question for AI is there a relationship between hemochromatosis and panic attacks? The iron load in your brain with the hemochromatosis patient causes panic attacks. Okay, and then the question was, this lady has PCOS and hemochromatosis. And is there a relationship between hemochromatosis and PCOS? And I went back to AI. And is there a relationship? Yeah, there is, because both have insulin resistance. So the tools are impacting clinical decision making and the relationship between the doctor and the patient, because I didn't have to refer them off to a psychiatrist or endocrinologist to get the answer. So
how are you incorporating the AI in your practice? How are you actually doing that as part of your workflow?
Well, I have a company that just does complexity. So every day we're hammered by cases that are just out of sight. When was the last time you saw pineal blastoma?
It's been, I don't know if ever.
Yeah, there have been 3 reported cases. We had one. So, there is no treatment in Canada for pineal blastoma. So you got to go looking for a proton beam machine. So we're always using tools like AI to help us figure out how to help people. I think what Tanya's saying is digital transformation should happen because it helps patients.
Raymond, I'm curious to know what the degree of accuracy is when you're incorporating AI.
Well, I mean, these machines can hallucinate. So, I wouldn't put all my bucks on the decision, but certainly if it seems to be compliant with your intuition and rational, etc. So you have to test each response for reality.
Right.
But on balance, it's getting better. So I've never really had an experience with the AI hallucinating in front of me.
Do you think AI will ever replace primary care physicians?
Not Jordan. He's got a great sense of humor and all that. But a little while ago, we were looking at the AI avatar nurse. Okay, have you ever seen those, Jordan?
No, what is this all about?
It's a nurse that's AI enabled. It's an avatar. And you could not tell. We're listening to the conversation between the patient. They're talking about the puppy and how was the weekend and everything.
Yeah.
And that was an avatar, AI enabled avatar. And you rent them for $9 an hour. So the whole world of healthcare staffing is likely to change.
How long until you can have a conversation with the doctor bot and it fools you? It's probably not going to be that much longer.
It was very convincing to listen to the nurse talk to the patient, and then get into compliance with meds and dosing and all that sort of stuff. So that was very cool.
Jordan, what are you seeing with Cherry Health?
in terms of AI. So we're using it for job creation, so people can input, kind of the framework of their data. I mean, just making a job ad look good is quite a daunting task, and so being able to actually just use AI to fill that in has actually saved quite a few people a lot of time. Going forwards, we'll extrapolate that out further, so you can just take your job post if it's already on LinkedIn, and it'll just suck it into the network and create it right there from you. We use AI to help with some of the scraping. So if we take jobs off of other sites and mirror them on our platform, it gets reformatted and bundled up into our categories and our standard packaging so that it's more accessible for people to use. So we're actually using AI a fair bit.
And I guess for reference, maybe you could talk a little bit about what Cherry Health does.
Yeah, so we're a medical network. It's almost like a social network for healthcare providers. The main thing people are using it for is jobs and recruiting. So connecting with employers, connecting with potential new hires. We've got lots of young new grads and students on there connecting for finding their next elective, or people looking for research opportunities, or connecting industry adjacent to the providers. But by far, the jobs and recruiting has been the hottest commodity. That's just the biggest gap in the system right now.
And who are you recruiting for? What's sort of number one?
Physicians for sure is the most popular one. We've just had more soak time in that market. That's where we started. So we kicked off in 2020 for physicians for locum jobs only in Calgary only, and then slowly grew that until it was doctors of all kinds across Canada and all different kinds of jobs. And then in the last year or so, I've expanded that into the allied health sectors as well. So it's catching on pretty quickly in the nursing and the pharmacy and the dentistry world as well, and hopefully continues into the other sectors as well here.
Curious to know what trends you're seeing.
Oh, it's just tough out there, especially for the medical clinics. Like it's no secret that everywhere is short of doctors right now. Lengths in terms of time to fill these jobs or almost seem like they're increasing as opposed to shortening. But yeah, it's very difficult. A lot of people are really struggling. We've seen lots of clinics messaging us like, hey, can you help us? We're probably going to be closing our doors soon if we can't recruit somebody. And it's just, I don't know, the canary in the coal mine perhaps is just the state of the jobs and the recruiting for Canadian healthcare.
I mean, what are your thoughts? On recruiting, on doctors just not interested in, or I guess the pool of doctors being less.
Yeah, I mean, that is part of the problem, is just the number of doctors and the total productivity of the pool of doctors. And certainly nurse practitioners are picking up a bit of the slack here. And, with the use of physician assistants and qualified clinical assistants and stuff, we're getting some help. But clearly there's a need for, really productive docs, and we'll hope the government figures it out.
Yeah, definitely the funding going into the allied healthcare and the other pieces. I'm hoping they start funding the physician side of things more, especially in primary care. Yeah, hopefully they pick up the funding on the physician side here, and it'll be interesting to see how the job description evolves. As the technology continues to turn over, as the AI continues to make us more productive. Do physicians wind up switching more to procedural based tasks and specialties? Is it more interventional and less talking, less history gathering? How will that get augmented for our diagnoses and our treatments versus, it'll be very interesting to see what a doctor's role looks like 25 years from now compared to today.
Yeah,
I think that's
very interesting points. I guess there's both challenges and opportunities ahead. And say thank you to both of you for being a part of the podcast. And listeners, please remember the future of our healthcare is shaped not just in labs, but in clinics and communities nationwide. Your engagement is crucial in driving change. Until next time, keep advocating for better health for all. Thank you.
Thank you.
Thanks for having me.
Take care.